Next up is Ms. Carrillo, AB 665. Ms. Carrillo.
Thank you, Mr. Speaker and members. Mr. Chair and members. I am proud to present AB 665, which would expand access to mental health care for young people using Medi-Cal. Across the countries, our communities are facing a youth mental health crisis, and the numbers are shocking, from mass shootings in public spaces and in particular in schools, school shootings, as well as fentanyl overdoses and social media bullying. Young people are experiencing a new reality, very different from the reality that we may have had growing up. A new report from the Center for Disease Control and Prevention states that 2 in 5 teens felt persistent sadness or loneliness. Among teenage girls is 3 out of 5, that's 60%. 13 years ago, there was a bipartisan agreement that we needed to empower young people to address their mental health needs as early and as quickly as possible. But we closed the door on young people that are Medi-Cal recipients. Only about 20% of young people receiving Medi-Cal get screened for depression, but we know that the need is much higher. We all deserve a life with pride and dignity. In our Latino community, we are shifting the stigma around mental health, and we're making it okay to say that you need help and you need someone to talk to. It starts with ourselves, our parents, our grandparents, to acknowledge the trauma of our families, what they have lived through, and recognize that there is a big difference between surviving and living. Here to testify and talk more about the need for this bill, in particular the need for mental health access for mental health recipients, as well as to answer any technical questions, are Rachel Valkov-Holtz, Director of Mental Health for the National Center for Youth Law, and Fiona Liu, a high school student and a Chief Policy and Legislative Director for Generation Up.
Thank you. First witness.
Good morning. Thank you, Chairperson Mainshine and members of the Judiciary Committee for your consideration of Assembly Bill 665, authored by Assemblymember Carrillo. My name is Rachel Valkov-Holtz. I'm an attorney and director of mental health at the National Center for Youth Law, a co-sponsor and strong supporter of AB 665. This bill addresses a deeply inequitable policy that creates added barriers for youth on Medi-Cal to access mental health counseling. We all want California's young people to live healthy, safe, and thriving lives. To ensure that, they need access to quality health care, including mental health support from trusted providers. California lawmakers have long recognized this. 2 years ago, the legislature offered enthusiastic support for the historic investment in the Children and Youth Behavioral Health Initiative, and more than 4 decades ago, the legislature passed a law allowing young people ages 12 and older to access outpatient mental health care based on their own consent in some circumstances. This longstanding right has been a critical pathway to care. But due to an inconsistency between parallel sections of Family Code Section 6924 and Health and Safety Code Section 124260, youth who rely on Medi-Cal must meet significantly higher levels of acuity before insurance will cover their care. In practice, this means that youth on private insurance can access needed care at an earlier stage, while youth on Medi-Cal must effectively be in crisis before insurance will pay for their care. Youth on Medi-Cal are predominantly youth of color and youth experiencing poverty, and this stricter standard compounds the already heightened risk factors they face. AB 665 would address this inequity by aligning the standards in the Family Code with long-established law in the Health and Safety Code, so that all youth can access the support they need without respect to which insurance they have. Removing this barrier is more important than ever given the mental health crisis that our youth are facing right now, particularly those youth of color with the fewest resources who rely on Medi-Cal. CDC data shows that rates of persistent sadness and hopelessness and of attempted suicide have increased, and that girls, students of color, and students who identify as LGBTQ+ experience heightened risk. Tragically, suicide rates of younger youth have also risen, making it even more important to open every door to care. I urge you to vote yes. Thank you.
Thank you. Next witness.
Good morning, Chair and members. My name is Fiona Liu, and I'm a high school senior in Orange County. I'm here today to represent Generation Up, a youth-led organization working on equity for youth in strong support of AB 665. AB 665 would align standards for Medi-Cal youth to be able to consent to mental health services, holding them to the same standards as youth on private insurers. Currently, youth like me on Medi-Cal are subject to higher standards, such as having to present serious danger to ourselves or to others in order to receive the mental health care that we need. As a student from a low-income family who uses Medi-Cal, these services granted by California offer great assistance to my family by providing essential healthcare access, even when we struggle with the costs of other necessities. However, as a student in high school and as a young person from a more traditional family, I can attest to the mental health stigma that causes youth like me to be afraid to talk to our own parents about our mental health struggles. In my freshman year of high school, when I struggled with depression and missed school often because of mental exhaustion, I only felt comfortable speaking with my friends and school counselor about what I was going through. My experiences are similarly reflected in surveys that show how teenagers report that having to get parental or guardian permission has been a barrier to getting the care that they wanted and they need. Additionally, since my mom works long hours to support my family on top of taking care of me, my little brother, and my grandma, her schedule makes it nearly impossible for her to accompany me to any potential treatment sessions. Also, similar to many other low-income youth, we often feel guilty that asking our parents or guardians to be involved with our mental health experiences would be putting an unnecessary burden on them. AB 665 does not create new policy to expand minor rights, but only ensures that youth who are on Medi-Cal, who are often already system-impacted youth, receive the same access to treatment when it comes to mental health. For these reasons, I urge your aye vote on AB 665. Thank you for your time.
Thank you. Witnesses in support, name and organization, please.
Good morning. Linda Way with Western Center on Law and Poverty in support.
Andrea Rivera on behalf of the California Pan-Ethnic Health Network in support.
Kim Lewis representing AspiraNet and the California Coalition for Youth in support.
Adrienne Schulten with the California Alliance of Child and Family Services, proud co-sponsor and support.
Rebecca Gonzalez, National Association of Social Workers, California chapter in support.
Priscilla Quiros on behalf of the California Academy of Child and Adolescent Psychiatry and California State Association of Psychiatrists in strong support.
Nora Lynn with Children Now, and also in support also on behalf of the California Alliance of Child and Family Services, Cal Voices, Generation Up, National Center for Youth Law, National Health Law Program, the Children's Partnership, the California Children's Trust, API Equality LA, AspiraNet, California Coalition for Youth, California High School Democrats, California School-Based Health Alliance, Casa Pacifica Centers for Children and Families, Communities United for Restorative Justice, Youth Justice, Community Health Councils, County Behavioral Health Directors Association, County Welfare Directors Association, Hayward Burns Institute, HealthNet and its affiliated companies, John Burton Advocates for Youth, National Association of Social Workers, Pacific Clinics, Southeast Asia Resource Action Center, Steinberg Institute, Sycamores, Thai Community Development Center, the Los Angeles Trust for Children's Health, and the Western Center on Law and Poverty. Thank you.
I'm not sure there's two more organizations, but you two can go ahead and go anyway.
Kelly Beam on behalf of HealthNet of California, serving over 3 million Medi-Cal members in support. Thank you.
Mr. Chair and members, Brandon Marchi with the California Medical Association in support.
Thank you. Seeing no other witnesses in support, witnesses in opposition.
Hi, good morning. My name is Erin Friday, the co-lead of Our Duty, and I'm an attorney. The analysis is wrong. This bill does not merely align two existing statutes, Family Code 6924 and Health and Safety 124260, such that minors covered by Medi-Cal can obtain mental health care without parental consent. What it does is greatly expand the power of a counselor relative to residential facilities. This bill permits a counselor to decide if a child 12 or older is mature enough to be placed in a facility away from his parents without any claim of abuse or indication that the child is in danger. 124260 does not address residential facilities, but 6924 does. This bill is state-sanctioned kidnapping. As existing 6924 requires an allegation of abuse or a risk of serious harm before a counselor can unilaterally send a child to a residential facility. The intent was to prevent suicide, specifically LGBTQ youth. Per the CDC, the year that 6924 was amended, 408 10 to 14-year-olds committed suicide. By 2020, it increased to 581. So the intent of 6924 failed. Suicides for the 14 to 24-year-olds grew to 55,355 over that time frame. Instead of repealing the failed law, the response is to place even more power in the hands of counselors to remove children from their loving families. An example of the caliber of counselors who decide if a 12-year-old comes home from school is Kenna Cook, who has access to the kids at Davis Unified. She held a BDSM group called Slaps Giving. She authored blogs, How to Be a Better Butt Slut. 12 is the age that California can steal the rights of parents and hand over mental health decisions to a child or worse, a pervert.
Next witness.
Hello, my name is Pamela Garfield Yeager. I'm a California State licensed clinical social worker who's trained at New York University. I was a practicing school counselor and supervisor for 10 years, in addition to working at multiple residential facilities. AB 665 is harmful to minors. School counselors are being trained to keep secrets from parents and take on an anti-therapeutic activist role. Instead of working with families, counselors are now dividing families, deliberately turning children against loving parents. Separating children from parents is one of the most traumatic things you can do to a child and should only be done as a last resort. The job of a therapist is to repair the family unit, not destroy it. It is apparent that one result of this bill would be the removal of trans-identified children from the home. In this dystopian nightmare we're living in, if a parent doesn't use a child's chosen pronoun or name, they're labeled dangerous. This is absurd and all based on the statistical lie about suicide. Completed suicides for trans-identified children are similar to kids with autism, depression, and other serious mental health issues. And I worked in group homes. I know what they're really like, and they're far from ideal. Residential facilities lead kids to adopt new harmful habits, such as drug use, self-harm, and violent behavior. Youth residential facilities are usually unlocked, and many kids run away into the hands of sex traffickers. Counselors are mandated to report genuine neglect and abuse, but this bill will remove this needed threshold requirement and cause more havoc on families. My 20 years of experience with families and children have taught me that conducting therapy without parental input is ineffective, just like the other bill where we're working with kids without their parents. And I've had many years doing that. It does not work.
Thank you. Any other witnesses in opposition? Name and organization, if any.
Greg Burt with the California Family Council in opposition. Thank you.
Lindley Hogan, Santa Clara County, mother of a daughter who thinks she's a boy. I oppose this.
Allison Snyder, registered voter, taxpayer, mother. On behalf of parents paying attention to the erosion of parental rights and state-sanctioned promotion of sterilization and mutilation of children, I oppose this bill.
Judith Cahill, registered Democrat, Santa Clara County. I oppose this bill.
Lisa Mullins, mother of a daughter I don't allow into the wellness center because it's so incredibly dangerous. I can't trust these therapists. No.
Yvette Corcoran, mother and registered nurse, San Francisco County. I oppose this bill.
Renee Yasamura, mother of teenage detransitioner. I oppose this bill.
Stan Helton, Contra Costa County, Democrat. I oppose this bill.
Susan Craigle, Democrat, parent. I oppose this bill.
Lavon Urbano, Placer County, parent. And I had a therapist tell us that our child is not going to be okay until she has a hysterectomy, top surgery, and hormones.
Emma Griffiths, student, Democrat, and I oppose this bill.
Beth Bourne, mother, Yolo County. I'm a Democrat, and I oppose this bill.
Thank you. Any witnesses, further witnesses in opposition? Seeing none. Questions or comments from the committee? Mr. Saley.
Thank you. Ms. Correa, thank you for bringing the concerns of mental health. I agree. I'm also concerned about the mental health of kids. And we had another school shooting yesterday. I mean, we have to have a big conversation of mental health, and I welcome that conversation. I hope that could be bipartisan. We need to look at social media and what effect that's having on kids. But unfortunately, I can't support this particular bill. I am concerned about a bigger issue that's happening in California, which is the erosion of parental rights. And I have this concern that children are being empowered to make adult decisions, whether that's seeking counseling in a particular way or other making medical decisions, and parents are being pushed to the side and treated as spectators of their kids instead of parents to raise them. And I think it's creating a wedge between parents and children. And I'm concerned about that. Kids need their parents. They need that nurturing. They need that support. And I don't think the state should be making policy that tries to separate them. We should be working together. And I do understand the concerns that some family dynamics have. They may not be welcoming to all forms of mental health treatment, but we need to have that conversation with parents and figure out how to overcome it. I'm also concerned about the constitutionality of this. The Supreme Court has ruled that parents have the right to direct the upbringing and education of their children and be involved in making their medical decisions. So I do have some constitutional concerns with it, but I agree with the premise, and I welcome a conversation. Hopefully we can work on the bigger issue. Just respectfully, I cannot support this bill, but I thank you.
Any other questions or comments from the committee? Seeing none, do we have a motion?
Move the bill.
Second. Motion from Ms. Reyes, second from Mr. Rivas. Ms. Creo, you may close.
Thank you. Thank you, Mr. Chair, and thank you to the members, and also respectfully disagree with the opposition, but always welcome parent involvement in any conversation related to the future of children across the state of California. This bill makes equitable mental health available for children on Medi-Cal. The original bill passed in 2010. It was bipartisan. It had no registered opposition. It was signed by Governor Arnold Schwarzenegger as California really began conversations related to mental health and young people. This only creates parity. So if you're on private insurance, you have all the access you can get. If you're a Medi-Cal recipient, you don't have any access at all. So this creates parity across the state of California, and I respectfully request an aye vote. Thank you.
Thank you. We have a motion and a second do pass. Ask the clerk to call the roll.
Mainshine?
Aye.
Mainshine, aye. Assali?
No.
Assali, no. Connolly? Aye. Connolly, aye. Dixon? Haney? Calra? Pacheco?
Aye.
Pacheco, aye. Pappen?
Aye.
Pappen, aye. Reyes?
Aye.
Reyes, aye. Rivas?
Aye.
Rivas, aye. Sanchez?
No.
Sanchez, no.
Motion is out. Thank you.